We have a health alert tonight. St. Louis area pediatricians are seeing more cases of whooping cough. 5 on your side's Laura Barcheski talked with health officials about the symptoms parents should look out for as people gather for the holidays. Laura?
Kelly, the St. Louis County Health Department says they're primarily seeing whooping cough in cases with kids, but it's very contagious, and even the parents are getting it too. Missouri Department of Health data says 603 cases of pertussis, also known as whooping cough, have been reported this year. 225 of those are in St. Louis County, which is a lot more than health officials have seen in recent years.
It's actually not unexpected. We've had similar numbers to these in the past, and whooping cough is pretty cyclic. So every couple of years, you'll get a bigger outbreak that'll last a little while, a community-wide outbreak like we're seeing now.
St. Louis County senior epidemiologist Amanda Brzezowski says one pediatric office is testing a lot more than others, which is good, but that also means there are probably more cases they're not aware of.
It's making us realize how much of a tip of the iceberg situation we're in right now. Imagine if every practice was testing as much as this one practice was. Instead of getting, a dozen cases a week, we would be getting 100 cases a week.
The most common symptom is coughing spasms that cause you to ultimately lose your breath or even throw up. Cardinal Glennon Dr. Aaron Miller says older kids and adults might not realize they have it, but it's very severe for infants who can be hospitalized for months.
They develop apnea, like instead of this terrible cough, they actually hold their breath and stop breathing, turn blue, and they can't tolerate their feeds. And we just have to, and the antibiotics don't do anything for them to decrease it. It's really just time until their body recovers.
Dr. Miller says vaccinations are the most effective tool for prevention.
One problem with the pertussis vaccine is that the immunity wanes over time. And so that's why we have to give so many shots. And there has to be, we recommend a booster at 11 to 12 years of age.
And people with whooping cough can be contagious for up to 21 days, making it very important to get an antibiotic as soon as you can to prevent the spread. Kelly.
Thank you, Laura.